Welcome back to Off the Cuff, EviCore Healthcare's podcast. I'm your host, Emily Coe. Today, we're going to talk about home care with a special focus on how home care can address social determinants of health. Our guest today is Katie Sherman. Katie is a licensed clinical social worker, and she is team lead of social work with Alegis Care. Hi, Katie.
Hi, Dr. Coe. How are you? Thanks for having me today.
Great. Call me Emily, please.
Okay, sounds good.
Welcome to the show. It's great to have you here today.
Great. Thank you. I'm really happy to be here.
So before we dig into social determinants of health, do you want to tell us a little bit more about your role at Alegis Care and what it means to be a social worker and with Alegis?
Yeah, absolutely. Gosh, I gotta figure out where to start with that one.
Yeah,
But basically, yeah, absolutely. So I work for Alegis Care. We provide a variety of really home-based services, primarily for seniors, but sometimes for people that might fall, under the senior standard per se. And we work to really bring that care into the home. So it's a lot for people that have difficulties getting out to go to a traditional doctor, or see a traditional primary care physician. We have different options to either bring a primary care doctor in the home or possibly a nurse practitioner and their team to give them some support services. So my role within Alegis Care is over and as part of the social work team. So we work, really in conjunction with those providers, like you were saying, to really try to target those social determinants of health, figure out what is really keeping this person from being able to have their best quality of life, and how can we work to really try to mitigate and take away those barriers to care. So really love doing that for sure.
Yeah. That's great. And so my familiarity with social work, I often think of social workers as the resource gatherers for clients or for patients. So you all know that, if there's an issue with someone's nutrition plan, you know where to get help and where to direct them, and so forth. Does that sound about accurate?
Yeah, absolutely. Social workers can provide a lot of different types of services. I think in this type of setting, you're looking at a lot of linkage is what we say, in terms of what is a person needing, and how can we link them with some type of either community-based resource or possibly even something within their own health plan, that might be able to, help them really just do a little better, or in some situations help a family have more support. So that's a lot of what you see in terms of social work. Even social work in general is obviously really broad, but when you're talking about this population and home care, you're really looking at that linkage, identification and then linkage to try to, remove whatever barrier is keeping them from having quality care.
Right. And you're also a teacher, right? You teach at a local university in Chicago?
I do. I've been really privileged to teach for the last, I guess this is my 6th academic year. So I teach in a Master's of Social Work program at Dominican University. I love teaching their students. I help students through human behavior and social environment courses, which is social determinants of health at its best, which is our topic for today, and then also help them through their field placements. So,
well, let's get down to the nitty gritty of social determinants of health. And I have a definition here that I want to read. There may be some folks listening for whom this definition or this term is new. But according to the World Health Organization, social determinants of health include the range of personal, social, economic, and environmental factors that determine the health status of individuals or populations. And social determinants of health are predictors of health outcomes. And that's why it's so important that we address them at the individual level through programs like Alegis Care. So, Katie, could you give us some examples of some social determinants that you see every time you go into, an individual's home?
Absolutely. I think that definition, by the World Health Organization is great, because when we talk about it, even in an academic setting, you're looking at so many pieces going into a person's quality of life. You have the medical treatment they're able to get, and then obviously if there's some pieces of genetics there, but a lot of research says there's this huge chunk still that falls under these social determinants of health. And what are they? I mean, they can be so many things. They're all the things that social workers pay a ton of attention to. You're looking at a person's, whether it's their socioeconomic status, meaning where they're able to live, if they're working, or what they were doing when they're working, how much income, you're talking about that financial piece. Sometimes you're looking at, again, where they live, and that doesn't just mean neighborhoods. It also goes into safety. It ties really closely into food then. Food security is a huge issue. I work in the Chicagoland area. We're always thinking and speaking about food deserts, areas where, if you're talking about somebody that has diabetes, you can't talk to them about diet, or things like that, when, I could tell you they don't have a grocery store, for several miles, or, looking at different pieces like transportation, huge social determinant of health. Can somebody get to their appointment or not? That's obviously going to have a huge impact, on how they're able to function. Overall, just also the other aspects of the healthcare system, being able to navigate things that gets into literacy, internet access, how many times do we take advantage that you can just go online and look up something?
Right.
A lot of our patients don't have that luxury. Again, literacy, just understanding all those different pieces, and then always, looking at, pieces of discrimination, equity, social justice, in our community. All of those tie into, the social determinants of health for a person.
So it's basically everything.
Yeah,
Everything that you can't treat with a medication.
Find something that's not under there, but it's all there.
Yeah. And I would imagine social workers have been addressing these issues way before it was, the social determinants of health phrase became a household term.
Absolutely.
And I know in my experience, talking about food deserts, it's not too uncommon for folks to get a lot of their food from local convenience stores. So you have to find a way, or teach the patient or the individual how to get healthy foods at a convenience store. And it's not like a lot of individuals can just call or order HelloFresh or have food delivered. So regarding the internet, I was curious as to how social media has influenced your ability to work with clients in their homes. Are they able to use different apps, or whatever would be out there to help them monitor their health?
Sure. I think it always depends on the person that you're working with, but I think we've really seen, especially as we've all been working, during the COVID-19 pandemic, I think I've been really surprised and pushed at, some of the ability, of especially our older population, to navigate, whether you're talking just different social media platforms, or peer support opportunities, which are huge. If you can connect somebody that's dealing with a chronic illness to other people that are also dealing with that, there's definitely that camaraderie sometimes can really improve, and especially when you're dealing with a population, sometimes it's really isolated, for sure. It's not perfect. I think there's always a need to for companies, and agencies, like Alegis Care and others that work in this field, to try to figure out how to bridge that gap better. Okay. Because you're always going to have people that don't have the access that you and I might have, with a couple smartphones or laptops or whatever it is sitting around, so how do we get something in the home, that can give them the ability to, do telehealth, or, like you mentioned, use some of those great, internet resources, to, really try to maintain and improve their health overall.
So during COVID, were you still going into homes to care for people?
Yeah, great question. So, I think generally speaking, each home care entity had a different approach, due to, different issues and challenges
Mhm.
going on. At Alegis Care, we did pull back out of the field, but that doesn't mean we pulled out of providing care, to the people
Right.
that we were providing care. So we really switched to, a telehealth model, whether it was our providers, meaning our doctors or nurse practitioners trying to
Mhm.
connect with people, via, some type of approved platform, that a person might have access to. But sometimes, honestly, us as social workers just had to kind of step back and do a lot by phone, do a lot by mail,
Yeah.
do things,
Yeah.
possibly viewed as a little bit more old fashioned, but again, kind of meeting people where they're at, still figuring out ways to provide,
Yes.
the services, even with us not being able to have boots on the ground, so to speak, in their homes.
Yeah.
Luckily we've been able to start getting back out, and I know
Yeah.
we're all really excited about that, but, it was definitely, quite a few, basically a rough year, of not being able
Yes.
to provide services the way we had been for quite a bit of time.
Yeah. Yeah. That's great. So tell me a little bit about your first visit with a patient or a client. So you have a new person pop up on your dashboard or whatever,
Sure.
wherever you get your information, and you go see the patient. What does that look like?
Sure, really good question. I mean, it can be, you kind of have to look at so many different variables. When you're first going out to see somebody, it's always a balance of trying to get as much information as you can, but also wanting to go in there, with really just an open mind, to get to know the person and see where they're at. So I will gather whatever information I have from the provider, that has possibly already met with the patient. Usually they've identified something that they're needing help with, whether it's transportation or needing more
Mhm.
assistance with their daily activities, or something that they feel is hindering their health overall. Okay.
Mhm.
So I kind of have that going in the back of my mind, but we'll go into the home, try really hard to keep it very conversational. It's a visit,
Yeah.
in the
Yeah.
end, so for social workers, I think we have the luxury of, let's just talk a little bit, have you ever met with a social worker before?
Mhm.
Have you had experiences with that before? Were they good or
Yeah.
bad? Let's talk
Yeah.
through that a little bit. Then
Talk
I,
about a barrier. Someone who's had a
yeah,
bad experience with a social worker, you're not going to get anywhere.
exactly. So
Yeah.
that's why if you can kind of suss that out a little bit to know, hey, this
Mhm.
is what happened, and this is, then you're already in a position to try to rebuild, that trust and that relationship at that point, even if it wasn't your relationship, so to
Yeah.
speak, at fault. But generally speaking, we have just general areas, really looking at social determinants of health to try to
Yeah.
figure out, sure, I'm here because I know you have a transportation barrier, but there's a decent chance sometimes that I'm going to be able to identify something
Mhm.
else that's going on. But
And
I
do you
think,
use a standardized assessment tool, or several different ones when you go in?
yeah, yeah, social
Yeah.
workers, we always say you kind of have to have a mixed bag, of
Yeah.
tools at your disposal. Sometimes we will, use, mini mental status exams, or depression screening. Sometimes if we're concerned about that, or different indexes or assessments to try to help us see what level of support a person's needing in their home,
Mhm.
and what areas they might be struggling in that maybe they wouldn't verbalize to you just by asking questions.
Yeah.
Sometimes you're able to hit on that as well. But I think when it comes down to it, social workers rely a lot on their ability to build rapport,
Yeah.
and just talk with people and talk and also observe. That's the
Yeah.
best benefit about going into a home. You can have somebody tell you on the phone, everything's great. It's
Yeah.
fantastic, best day ever. And you can get there and you're like, this is not the best day, and
Right.
let's talk a little bit about like what's going on.
Yeah.
Are you having some trouble getting your groceries put away? I see you got a delivery.
Mhm.
What are the barriers to what you're needing? What
Yeah.
are you really needing assistance with?
Yeah. So, how do you involve families in this conversation?
I think it's right off the bat. I mean, at Alegis Care, we work with, a very chronic illness population. So a lot of times the families are involved right from the beginning, because maybe a person really isn't able, unfortunately, to communicate for themselves as easily anymore. So families are almost always involved from the very beginning. And if they're not, I'm coming in and asking, hey, tell me, who's around, who supports you, understanding that for a lot of our patients, family doesn't just mean children, siblings, things like that. I think one of the best things that I've learned is like somebody's closest person can be the neighbor
Yes.
2 doors down, who isn't going to necessarily show up if you start asking them, do you have any children? Do you have any, you have to listen to them as they're telling you who the people are, or maybe they're connected to a faith community, or you find out that they have, somebody connected with them through some community services already. So now that they're a resource as well.
Yeah, that's a really great point. We always think of family members being in the homes, or visiting mom or dad or whomever to help out. But in a lot of cases, the family, they're in different cities, different states. So it is the
Absolutely.
neighbor and the church family helping out. So that's really great. So let's see, health literacy. So health literacy is, for the listeners, is not only the ability to read health materials, but also being able to act on the information that you're reading. So do you find yourself teaching skills? So helping to make communications more understandable, and then also providing skills to show them how to apply that information?
Yeah, absolutely. I mean, it's one thing to hand, if you're using like a very physical example of like a pamphlet to somebody with some information, and even if they are able, like you said, to, really read it, can they take it? Can they apply it? Or if the literature contains like a resource, for example, are they able to access said resource, and really be able to figure out how to, utilize that and actually make that phone call, make that connection. A lot of what we do is, really, hey, what I'm hearing is this could be really helpful for you. Let's call together, so
Yeah.
doing, whether it's
Oh,
calling in the home, if you're lucky enough to be there, or during COVID, and honestly, always the three-way call can be magical, just to
yes.
say, hey, let's call together, let's get this other agency on the line, and then we'll make sure you are connected, because sometimes it's that warm kind of transfer and warm
Yeah.
connection process. It's just is really making sure that somebody's able to take that information and in the end do something positive with it, and it isn't
Mhm.
just going to be something else that's sitting there making
Yeah.
them feel like kind of overwhelmed.
Yeah. It can be overwhelming and daunting
Hmm.
for, anyone, even us, and we work in healthcare. So
Absolutely.
that's wonderful. And what about for folks where English is the second language? Do
Mhm.
you all offer, Spanish or, other languages when you interact with the clients?
Absolutely. So in some areas, we're fortunate enough to have bilingual staff, which is obviously fantastic, especially for,
Mhm.
we have a certain group of patients that are down in the Valley area of Texas, which is a predominantly Spanish speaking community. So we are able to have providers that speak both languages. But if we don't, for example, myself in Chicago, unfortunately, I don't speak fluent Spanish,
Mhm.
so we are lucky enough to have professional translation services that we can access by phone, and it's not ideal,
Yeah.
but it gets the job done,
Yeah.
and I have found in the end that the patients, as much as they know it takes a little bit longer, they're really appreciative of knowing that they are heard. Um,
Hmm.
Sometimes we do have family members, that will do translations, but I think whenever possible, we try to err with some type of professional translator, because especially when you're talking about, medical conditions and things like that. You don't want a well-intentioned family member to maybe phrase something, possibly in a less concerning note or a more concerning note, than you
Yeah.
intended it to be. It's
Right. Yes.
really don't want something to get lost in translation then.
Right. So let's say you have a new patient. What is the typical duration of your interaction with that individual over a period of time? Like how many visits, I
Yeah,
guess?
absolutely. So the really nice part about what we do at Alegis Care is social work is given a lot of autonomy. So I think it's really hard to, like, so to speak, prescribe. I think you're going to need X number of visits to get to, a better level of functioning, in a way that, let's say, like physical therapy might be said, we're going to do 8 visits and then
Yes.
see how you're walking. Social work just doesn't really work like that.
Yeah.
So our social workers are trained to approach really each person that we're working with individually. So for example, if I'm working with somebody new and I'm noticing, they need transportation linkage and they need help getting, like a homemaker, for example, in the home, and, maybe they're needing some help with advanced directives or things like that. I may have a once a week, visit, whether it's by phone or in person, with that patient, over several weeks while we're getting everything in place. And then once they're more, I always say, secured and supported up, then we might be able to drop that frequency down, ideally to a point with patients that I've been working with for years that I can say, hey, I'm going to call you in a month and just make sure everything's still in place, and going okay, because
Yeah.
you don't want to get that call of, oh my gosh, my meals haven't been coming. It's like, if I'm continuing to check in, I can be on top of that. So
Yeah.
not a direct answer because it can vary, but I think that just shows that it's really specific and specialized to the person. It's not one size fits all.
We hear a lot about burnout for social workers because it can be so emotional and just hard on folks who go into this field because you are caring in the first place, and it can be have a lot of stressors. But tell us a little bit about, are there any really great, is there a great story that you would like to convey that reminds you of why you are a social worker?
There's so many people that, that I've had the opportunity to work with over the years that, really stand out as, people that we've been able to have a positive impact with. I think sometimes you have to, I always tell my team, I said, you have to take the small wins. Okay. Sometimes if you're constantly waiting for the big full picture, the magic, you might miss the really, really small things, and I think sometimes, you really have to look at, whether it's just, for example, I've been able to work with different people and help them get, more people to come into their home to provide them some services, and just providing that help with navigating that, while it's really just, sometimes can just be seen as, okay, I checked that off my list. They're good to go with that. That's good. You have to take a step back and realize what was the impact on that person's life, and I've been fortunate enough in the time that I've been, practicing, and then especially with Alegis Care, to be able to have my patients tell me, this really helped, and I feel, and I have to feed off of that and those moments, and remember that it's those really little pieces, it's kind of the old adage, if you blink, you'll miss it, if you're waiting for, the most major thing to happen, you probably missed 6 really awesome things that happened underneath, so I think that's how we try to, keep going. And I think with our team, I've been lucky, one of the members of the team that I work on put together some self-care tips, for everybody at Alegis, while we're all practicing in this COVID-19 pandemic. And one of the ones I liked the best was really talking about mindfulness, because I think for me, I felt good about that one because I didn't feel like it took a ton of time, because I could never balance that. Well, if I have to spend, half an hour on self-care, then I'm really stressed out that I just missed half an hour of things I could have been doing.
Exactly.
So for me, it's like mindfulness. Okay, I'm okay with taking just a couple minutes, to ground myself and center myself and pause, and then go
Yes.
back. So
Yes.
that one has been definitely stood out for me, pandemic or no pandemic.
Yeah. Yeah. And I've found mindfulness helpful for me, individually and also in my programming as well.
Mhm.
It's just it helps with sustainable behavior change, I think. Uh,
Absolutely.
I asked some folks to provide questions,
Okay.
questions from the viewers, I guess, related to home care and social determinants of health. You have addressed a lot of these already in your responses, but let me revisit and see if there's anything you would like to add. So
Sure.
one question was, what type of workers deliver home health or home care?
That is a really great question. And I found so many times that, people are so overwhelmed at this. And there's so many different pieces that go into it. So I think if you yourself are getting to a point of feeling like you might need some assistance in the home, or possibly you're looking at this for a family member, whether it's an
Mhm.
aging parent, or whatever the situation may be, there's a couple different things to understand. You have a couple different resource banks that you can try to pull from. And all of them have different requirements, but ultimately, to keep a person in home for as long as possible safely, which for a lot of people is their goal. Okay, you have to try to figure out your right puzzle of these resources. So, one stream that I think people are sometimes most familiar with is tried and true home health. And when you hear home health, you should automatically be thinking insurance. That should go off in your head
Oh,
as a moment.
right.
Okay.
Yes.
And whatever that means, whether you're talking straight Medicare, Medicare Advantage, a private insurance plan, whatever that is going to be something that your doctor feels is medically necessary.
Mhm.
So your doctor has identified a need, so
Yes.
whether
Okay.
you're needing physical therapy, occupational therapy, home health, wound care, something like that coming into the home. Something to remember with that, they're usually time limited. Okay, so we're looking at, a certain number of prescribed visits, and then, maybe they'll renew it for another one, but this is not going to be your long-term answer to anything.
Got
Okay.
it. Okay.
So from there, and the people that provide those are nurses, predominantly, or possibly certified nursing assistants, or the respective therapists as well.
Okay.
Um,
Got it.
so there's bucket A.
Okay.
I guess bucket B, you're looking at really assessing, what your local community resources are. And when you're talking community resources, you're really looking at whatever your area on aging is. So Department of Aging, is something that exists at a federal level, and every state has its own entity. So sometimes you kind of have to start even at a state level is sometimes a good spot to start resourcing, or ask a social worker if you have access to one.
Right.
But, we're able to kind of figure out, hey, this is what they're needing with, and these are more long-term support services. Okay, so this might be, they usually do what they call a determination of needs assessment. So trying to figure out they need help with groceries, laundry, different things like that within the home,
Okay.
possibly some personal care. But those sometimes also come with eligibility requirements related to
Mhm.
finances. So if you have a lot of money in savings, then sometimes you're not, unfortunately, going to qualify for
Okay.
that. But you still have, like, at that point, like a private pay bucket that you can kind of dip
Mhm.
into in terms of looking at other community resources that are available for you to do what I would say more a la carte type options. Hey, I'm really needing help with laundry and cleaning. Let's look at getting somebody to come 5 to 6 hours a week.
Okay.
So it's those three buckets, kind of, you try to piece it together to get you to a more stable point.
Okay, that's great. And I think probably a lot of folks don't know that home health and home care are different. So home health equals insurance, possibly Medicare approving a provider requesting services that may be medically necessary. And then home care is the coordination of local resources that can
Mhm.
help improve someone's life, possibly through
Absolutely.
Meals on Wheels or
Mhm.
laundry, that sort of thing. Okay, great. That's very helpful. Thank you. So I have a silly question. You go into a lot of different homes. What if a social worker has a cat allergy and their patients have cats? What do you do in that situation?
You slowly back away. No, I'm kidding. Um, it happens all the time. I think there's different levels of, we call them environmental hazards.
Oh,
There's different levels, right? I think, a good social worker asks ahead of time two main questions. Who else is going to be there when I visit? And what else is going to be there when I
right.
visit? Just so that you're aware, because if you're deathly afraid of dogs, you can
Yes.
ask, hey, can you please make sure the dog is either crated or possibly in another room? And most people are very respectful of that.
Yeah.
So you're able to kind of have that conversation ahead of time. The who's going to be there is really important, like from a safety perspective,
Oh, right.
to know who you're going to be anticipating interacting with, and then if you get there and possibly there's more people, you're talking about somebody's health information, so you want to be
Hmm.
respectful.
Yeah.
But yeah, it's tough. I myself am allergic to cats and have definitely been in the home and seen the cat creeping along the back of the couch, and I'm like,
Oh,
okay, don't touch your eyes.
oh
Don't.
no.
But it's okay. I
Yeah.
think those type of things you can work past and get through, and most
Yeah.
patients are very respectful and very thankful that you're there in the home to help them, so they'll shoo away whenever they need to.
Right.
So
Oh, that's great. I know one of Alegis' primary goals is to reduce hospitalizations of patients and also to reduce readmissions into hospitals. Can you tell us a little bit about that?
yeah, absolutely. There's so many different pieces of what we do at Alegis that really centers on that. And I think one of the key pieces, we're obviously providing medical care and medical treatment, which is a huge part of it. Okay. Whether it's identifying somebody has an infection, before it gets to the point of having to go to the hospital,
Mhm.
or things like that. Or when a person's, discharged from a hospital, quickly doing a follow-up visit to make sure they got their medications, they got what they needed, they are actually feeling better. There's of course that medical component, but I think one of the key pieces that differentiates Allegis's approach is that we do tie into these social determinants of health, and we understand how those factors also can possibly make a person hospitalized or readmit, that was unnecessary. So really looking at, whether it's them having their in-home supports in place, to make sure that they are able to, like we said, just getting their medications, for example.
Mhm.
We have to follow up to make sure that they have, whether it's their transportation to get to a specialist appointment, if they're discharged and told you need to go and see a cardiologist, this is very, very important. We're following up not only from a medical perspective to help them coordinate with that cardiologist, we're also asking the question of, how are you going to get there, and how are you going to have the finances to pay that copay, if you're worried about that, for example, and if they give you information from the cardiologist, talking about health literacy, are you able to digest what that means, and what those next steps are?
Right.
And I think all of that ties in, because if you don't have that follow up, that need for the cardiologist could just fall off, and then the person could readmit again, whether it's 2 weeks or 2 years down the road because of an issue that should and could have been addressed. And I think that, Alegis Care does a great job of trying to intervene in that situation.
Yeah, that's great. So the touch points and making sure that they are engaging in the self-care
Mhm.
or following up on their appointments, all of those things to help manage their condition, help prevent the hospitalizations. That's
Right.
wonderful. Thank you.
Okay.
So now we've talked about COVID. Um, have you seen, pre-COVID, televisits were kind of like a a weird, strange thing to a lot of
Right.
people. And now, because of COVID, we've been forced to have more televisits with our
Mhm.
providers. Have you seen a positive shift in acceptance of televisits as just routine?
Absolutely. It's been really interesting. Alegis now has been able to start getting back out into the field. And I was actually
Mhm.
just on a call earlier, and one of the patients was a provider was talking about how one of their patients said, we can just do this by phone. I don't want you to have to drive out here. They were okay and felt like their needs in that moment were getting met, by that telehealth component. And I think a huge piece that kind of warms a social worker's heart, so to speak, and then I hope honestly like stick around post COVID is other disciplines, accessibility and proficiency with telehealth. So previously, we can come out as possibly a primary care physician or a collaborating nurse practitioner, but we still have to try to get this patient physically to a cardiologist or a pulmonologist or even an oncologist. Now, it might be possible that they can go once, and then possibly follow up,
Yeah,
via telehealth. And that is huge when you're
yeah.
talking about a population that is not able to get around, just hop in your car and get around and go.
Yeah,
It's absolutely, just really important. And then again, when you tie in that mental health piece, I think the idea of having a telehealth appointment with a psychiatrist
mhm,
was unheard of, prior to all of this, other than a
right.
very rare exception. So I truly hope that not only providers continue to embrace this, but the regulatory boards and Medicare, CMS, continue to work to make these options. We're really talking about accessibility, not only for an
Mhm.
aging population, but also people with various other disabilities that might keep them from accessing
Yeah,
traditional brick and mortar healthcare.
yeah. That's great. So, I guess we could look at it, one positive outcome of COVID is that it's broadened your reach. You
Yes.
can reach more patients more often, more consistently, which may ultimately have an impact on reduced hospitalizations. So maybe that's the silver lining in all of this.
Mhm. And we were even able to see that with regards to, take, for example, like our chronic care population at Alegis Care. They were used to seeing their doctors in person in their homes once a month. Well, during COVID, the doctors were not able to go out and visit in person. So sometimes they were doing increased telephonic touches, and sometimes those increased telephonic touches, were able to even mitigate even more, to keep people out of, especially in in that center of COVID with hospitalization rates so high. That was the last thing we wanted our patients to have to do
Right.
unless they really needed it. So our providers were able to, get crafty, which they always have been, but they were able to really like increase that exponentially. And it was really amazing to see. And like you said, I hope that that's the odd, the odd
Mhm.
bright side that comes from all of this.
Yeah, that's great. Thank you. So, Katie, in this time of COVID, what are some guidelines that you are giving your social workers and also patients as far as preparing for a visit during COVID to help keep everyone safe?
That's a great question, and obviously center to when we did, pull back from the field and focus more on telehealth, we realized when we do go back out, we have to have a plan, for how to do that safely. So there's a couple different factors that go into it. Obviously, all providers, have been encouraged, and if able to and willing to, been able to get vaccinated. So obviously a huge part of, getting this pandemic under control. So that is a huge portion of it as well, but also there's multiple screening tools in play. So we're really looking at outreach outreaching and confirming visits with patients beforehand, and then asking them pertinent questions, asking them to take their temperature, talking about if they're displaying any type of symptoms, and then also going through steps ourselves to really self-screen ourselves as well, to make sure, vaccinated or not, that we're making sure we don't have any symptoms, and then also limiting the amount of interactions we have per day. Pre-COVID, I might have gone out and gone to 5 different patients' houses back to back to back to back. Now it might not be as many, and obviously there's different steps that get taken in between visits, so whether it's sanitizing our hands, for our providers, sanitizing any equipment that they may have. We have different mask protocols that we utilize so that we are always masked appropriately. And we also ask that our patients and anybody else that would be present in the home is masked as well. And we're even able to help provide, some basic masks if that is an issue, for some reason. Luckily, it seems that most are accustomed to it at this point, but just going through and making sure all the screening is done, and really that professional obligation to ourselves to make sure that we're not doing anything that could be potentially putting our patients at risk, first and foremost, secondary, ourselves at risk as well.
Yeah, here in California, before I go for any provider visits, I have to answer the checklist of questions such as, have I traveled by air in the past 2 weeks? Has anyone in the home also traveled, by plane in the past 2 weeks? Do you ask those similar questions as well?
We do have a standard set of questions that we run through, related to, like I said, temperature, travel, any concerns, really self-monitoring of symptoms, questions related to exposure, if anybody has tested positive in the home, or if you've been exposed to anybody that's tested positive, hence putting you possibly in a quarantine status, and I think that the positive at Alegis is we have such a strong rapport with our patients that, the screening is obviously of the utmost importance, but it's almost like before you're even screening, patients are saying, no, you can't come this month. This is what we're doing. And honestly, our patients that have, either been directly impacted by COVID, whether testing positive themselves or loved ones, are usually reaching out to us and saying off the bat, hey, I'm worried or concerned, and we can help them coordinate getting tested in the home. There's a lot of home health companies that are able to go out and do that testing if they're not able to get to their local pharmacy, or whatever the local testing entity is. So it all comes together to make it as safe as possible for both provider and patient and family.
Great, thank you. Katie, thank you so much for today's conversation. I loved hearing the social worker's perspective on how to address social determinants of health. This has been very informative. Thank you so much.
Thank you so much, Emily, for the opportunity. It was really wonderful. Thank you.
Great. Thank you for listening to Off the Cuff today, EviCore Healthcare's podcast. Join us next month.